Today's session will cover tools you can use, exploring tools for family caregivers. As I said earlier, my name is Chance Browning. I'm the Senior Director of Programs here at Caregiver Action Network. So in today's session, your camera and mic will be turned off, so you can't hear us. Or I'm sorry, so we can't hear you necessarily. We do want you to chime in via the chat function, and we will have some questions throughout today's presentation. And if anything comes up, please add to the chat bar your questions, and we have set aside time at the end of today's presentation to address some of those. I know we've received some questions in advance, so please keep those coming. If we don't get to your question today, we will send a response via a follow-up email. So we will do our best to make sure everything gets addressed today. So now that you see us on screen, you'll be hearing our voice most of the presentation, but we'll be back on screen at the end for the question and answer portion. So today's presentation is a collaboration of Caregiver Action Employee Network and USAID Staff Care. So we want to thank all of you for joining us today. So Caregiver Action Network, a little bit about us is our mission, as you see on the screen, is to empower and support the nation's 90 million family caregivers. We provide resources, tools, and training like this one so that family caregivers feel more equipped in their role as a caregiver. Making sure family caregivers feel prepared and supported in their role and less stressed really is what we're trying to do here. So many of us here at CAN are caregivers ourselves. Many of us are long distance caregivers, like those of you who may be joining us today. So we really are in the trenches with you and understand the struggles of caregiving day to day. As I said earlier, we want to hear from you. Nicole, do you want to talk a little bit about the polling?
Sure. So during the course of today's session, we'll also be using some interactive tools with questions that we'd like you to answer. These really help us understand where you may be coming from and some of the challenges you face. You'll find these in the tab labeled Polls on the right-hand side of your screen. And of course, just to reiterate what Chan said just a couple of seconds ago, if any questions come up throughout the presentation, please enter them into the chat window, and we'll do our best to address them at the end of today's presentation.
Fantastic. So caregiving is difficult work. I think we all know that. And one of the keys to doing this work is being equipped with the right tools. So today we're going to talk about some of the important tools that can really help caregivers navigate some of their most challenging tasks. Those tools will be a patient file checklist, a medication list, having a go bag ready. But in addition to that, we're also going to walk through how caregivers can make the most of an ER visit. We know those are unexpected, and there's a certain degree of planning that can't go into that. But being prepared in those instances is really important. So we're going to talk a little bit about that. We're also going to cover how you as a caregiver can effectively talk to your loved one's doctor, including in those ER visits, and also touch on, symptoms to monitor and how that may change throughout the course of it. So we'll start with the tools. We'll build on that information with tips about ER visits. We'll then get into symptoms and then do a little bit of wrap up. But like we mentioned before, these tools can make a world of difference in tackling your tasks as a caregiver. And so we first want to kick off this section with a poll question. So I will let Nicole read that question, and I will activate that poll on the right-hand side of your screen.
Great. So the first poll question that we have for you today is, do you currently use any technology in managing your loved one's care? These can be things like an app on your phone that helps you manage your loved one's medical appointments or remind you when a medication needs to be refilled, anything along those lines that you use to help you in your role as a caregiver. And so your options are yes, no, or not sure. Now, if you answer yes, please feel free to share what technology you use in the chat.
Fantastic. So we'll keep that live for a little bit longer so you can make sure you get the poll question answered. But we're really going to dig into initially our two tools that we want to focus on, the patient file checklist and the medication list. These are useful for caregivers across the spectrum of caregiving scenarios, no matter if you're caring for an aging parent or a child with significant health needs or anything in between. So let's explore that in a little more depth. As a note, these are available to download at USAID caregiverscan.org, and they are located within the Caregiving Right Now section. I'm also going to provide that link in the offers section, which should pop up on the right-hand side of your screen as well. So you should be able to click on that and open up that tab throughout today's presentation. But again, these are accessible 24/7 at USAID caregiverscan.org. So to dig into that a little bit more, with the patient file checklist, the purpose of this really is to help family caregivers keep all of their loved ones' medical records and relevant legal documents together, organized and updated. Having all of this information in one place is important because all members of the care team, not just you, there's often many members helping to care for your loved one, and they need to understand what each of these elements mean. This can include things like test results, maybe specific medical terminology, depending on your loved one's circumstance, that may be confusing, and the legal documents that we mentioned before. So what should be included in here? When we're talking about medical records, this really does include various test results, vaccination records, information about your provider. This is especially important when your loved one has many different doctors or specialists, especially if they're not in the same network. Nicole's going to talk a little bit about medical records more in depth here in a second. But you also want to think about including your insurance info in this, a copy of your loved one's insurance card, perhaps any associated details with prior authorizations or anything like that. The medication list, which as I said, Nicole will touch on here in a second. One thing I want to talk about in regards to legal documents, we want to think about these being accessible and having them handy at any given moment. As we were talking about earlier, ER visits are stressful and unexpected in many circumstances. And depending on your loved one's condition, they may have a DNR or do not resuscitate or a living will in place. In all of those instances, you want to check with the state, municipal, and hospital systems requirements to make sure that you have a full understanding of what all is needed in those circumstances. But a friend of mine, which is a story I share often about this, is she had to rush her father to the emergency room, and once she got him there, the attending doctor came out and asked, because of his circumstance, was there a DNR? In that moment, she said, there is, but I have it in my car in the glove box. Let me run out and get it. And the doctor, in that instance said, no, we need it right this second. So you can see in instances like that, how important having some of those documents and details with you on your person is so important. Some people organize this in a binder, some people organize this digitally. It really depends on what you're most comfortable with. I know if you're a long distance caregiver, a digital option may be best for your circumstance so that you can easily email or transfer some of those files as needed. But think about how you can do that with maximum efficiency. Some of this may be uploaded to, Google Files or Dropbox or something like that. You really have to figure out what works best for you. So what you see on your screen here is an example of, how we might break that down. But again, you want to make this your own. As I said, some people prefer printouts in a binder, and some people prefer digital options, or there are even apps out there that can be really handy for organizing some of this. So the checklist you see on your screen, again, you can access in the Offers tab on the right-hand side, or by going to usaidcaregiverscan.org. It really is intended to be a starting point and for something that you really can adapt and make your own. So at this point, I'm going to hand it back over to Nicole to talk a little bit about medication lists.
Great. So let's shift gears and talk about the medication list. This is a comprehensive list of all medications being taken, and it includes over-the-counter medications, supplements, and also includes the individual's vaccination information. I think living in a world that has experienced the COVID-19 pandemic, it's probably clear as to why vaccination records are important, but I think on top of that, we've probably all been asked by a doctor or had to respond on some form when we last received a tetanus shot or when we received our MMR vaccines. It's an often overlooked but important part of that list. This medication list should be part of the patient file, but may be a piece that other members of a care team, family, or friends also helping out may have a copy of, particularly if you are caring for a loved one at a distance and they're helping with medications in any way. So I'll share a brief story on how I have used a medication list. I cared for my grandfather when he was diagnosed with bone cancer, and due to chemo and radiation and other medications, he didn't really have much of an appetite, but there was one thing he did like, and that was milkshakes made with Ensure. And it took a while for me to perfect the right recipe, but I used kind of a medication list and noted how many cans of Ensure we went through each day so we could track that as a supplement. And we were able to flag if, he was taking in less, because it was really important to stay on top of that. And I also kept my recipe with all of this information as well, so that if my mom or my sister were coming over to help while I ran out to do errands, they could make sure to make the milkshakes just right. So it's something, again, with supplements and things like that, not something that you may think needs to be part of a medication list, but is really important. And not just communicating, like in my story, to family about, the things that my grandpa was taking in. But, if we were going to a doctor's appointment, I could provide that information as well. And it's really a key part of making sure that everyone has that information. So let's really get specific on what should be part of that medication list and drill down a little bit further. So the name of a medication is a pretty obvious one here, but make sure to include any generic or brand names if applicable. Dosage, so how much and when. The dosage should be reflective of the current dose your loved one receives, but should also know any past dose they received, if there have been any changes. It's really good information to keep on top of. How it's administered. A medication can be administered via pill or injection or patch. So, making sure to keep that noted. What the medication looks like. Does the pill have a specific color? Noting things like this may be helpful for other family or friends that assist with your loved one's medications, or if your loved one takes their own medications, and it can ease. If you're taking multiple medications, it can be easy to get a little bit confused. What pill is what. So that information can be really helpful to also add. You'll want to know any side effects your loved one has experienced with the medication. Does it make them sleepy, irritable, nauseous? These are important things to keep track of for providing updates to your loved one's doctors and other members of the care team. When was the medication prescribed? Keep track of current prescriptions as well as old ones for record-keeping purposes. And pharmacy info. And that should include, the contact information as well as the pharmacist name. Now, one thing I do want to note, with certain conditions, the time of day a medication is taken can be very important. If other conflicting medications are taken due to comorbidities, they may need to be paced at different times of the day or adjustments made to the medication schedule. So again, when we're talking about the dosage, of how much and when, that just kind of speaks to why that's an important thing to hit on as well. So this document that you see here is a guideline to help you put together your own comprehensive medication list that includes everything that I just kind of went through. And it can be found on the USA CaregiversCan.org website in the Caregiving Right Now section. So, back to that offers tab, you'll be able to find this medication list there, so you can kind of adapt and make it something that is comprehensive, but something that speaks to what you need as well. And so with that, I'm going to turn it back over to Chance to talk about a go bag.
Fantastic. Thanks, Nicole. The final tool we want to cover today is what we call a go bag. And, this may be a familiar term for anyone who has ever had a baby or known someone who's had a baby, but the same idea applies to when you're caring for a loved one who may frequently require visits to the ER or hospital. So what we're talking about with the go bag is really a bag that's packed and ready to go and can be grabbed in the case of an emergency. Having this bag ready can really eliminate a lot of stress for family caregivers because they can feel more confident that they have what they need if their loved one needs to go to the ER or hospital. So you may be asking yourself, what do we want to what needs to be packed in a go bag? So there's those crucial documents that we talked about at the beginning, the patient file and the medication list specifically. One thing to keep in mind here is every time your loved one goes to a doctor's appointment or has a checkup, these will likely all need to be updated. So keep in mind that taking that binder out of your bag or updating the files digitally is something that you need to roll into your regular routine. Another thing we have on the list here is a blanket or maybe a light jacket. Anyone who's been to a hospital or ER room or emergency room knows that it can be really cold in there. And so having a blanket or a jacket can make that a little more comfortable. Snacks and water are super helpful. Trips to the ER usually means significant wait times. So having that, snack and water for you or your loved one or other family members can be super helpful. A change of clothes. Many individuals, your loved one may be admitted in some circumstances. So having a change of clothes for either you and or your loved one will be helpful in those circumstances. A phone charger, that is, becoming a more and more important thing to keep in there. Having a sort of separate duplicate phone charger to put in that bag so that you're not searching for yours in those moments is very helpful. Maybe a little bit self-explanatory, but with emergency circumstances in particular, there's a lot of communicating that has to happen between you and other family members and friends and loved ones about the circumstance of the person that you're caring for. One other note that we've heard a lot, specifically during COVID, is making sure you have your loved one's phone charger as well. Maybe your phones are the same and you can use the same charger, or maybe they're different and you need two separate chargers. But because of COVID and access, many facilities won't allow you to be back with your loved one. So, if they're in a condition or a state where they can text and communicate, having their phone and having their phone charged is important in that sort of communication exchange. And then the last thing we have here is a book or a crossword. Like we said earlier, these are, you're going to be sitting in the waiting room a while, more likely than not. And so having something to pass the time, like a book or a crossword puzzle or a video game, is very, very helpful. So it's important not only to have the go bag packed, but having it where anyone can access it. Any number of people may be helping care for your loved ones. So keeping the go bag near your loved one is often very, very helpful. And just like we talked about earlier, making sure you keep those medical records and documents up to date. You also want to check your bag. If you have snacks in there or batteries or something else that may expire, you want to make sure you're checking that on a somewhat regular basis to make sure that all of those items are up to date and current. So at this point, we have talked about tools. I'm now going to hand it over to Nicole to talk a little bit more about ER visits.
Thank you. So we've talked about trips to the ER when we've been discussing the tools and how family caregivers use them in the case of an ER visit. But now let's cover the logistics of a trip to the ER and go over some tips that help family caregivers navigate what's typically an unplanned and often stressful event. So let's get into some tips for an effective ER visit. So have the go bag packed and ready. Chance just did a wonderful job at breaking down the items that should go in the bag and the importance of having it easily accessible so that nothing crucial gets left behind in the rush to get out of the door. Once you're at the ER, introduce yourself as the caregiver. Let the staff, the doctors and nurses, know who you are so that they know you're the one that they can come to with updates. It is a really important step to setting up a good rapport with the medical team assisting your loved one. Have all of your information, like the patient file with that medication list and all the medical records, on hand so you can answer any questions from the doctors and nurses caring for your loved one. And use that information to share your loved one's diagnosis. So it could be heart failure, COPD, Alzheimer's, with the medical team. Know what symptoms to report. Chance will go over this in much more detail in a minute, but I do want to stress that it's important to remember that you are reporting a symptom and not a further diagnosis. Stay calm. Your loved one may already be nervous or scared, and that is on top of the already hectic energy of an ER. So being calm can help them feel more at ease and more comfortable. Things are fast-paced in the ER, and there are many other patients being treated. So please be patient while waiting for updates and try to stay out of the way of the staff doing their job. But of course, that doesn't mean you can't ask for updates. Just be mindful of not asking a staff person when they're kind of in the midst of helping another patient or things like that. And connected to that is making sure to express thanks to the doctors and nurses. That gratitude is incredibly appreciated by those hardworking doctors and nurses, and it will mean a lot to them. So I'm now going to turn it over to Chance to go even deeper into reporting symptoms.
Awesome. Thanks, Nicole. One important thing to keep in mind is how and when you report your loved one's symptoms. We often say you as the family caregiver spend more time with your loved one than anyone else on the care team, including the medical professionals. So you know them best. Even in instances where you are a long-distance caregiver, you are likely talking to them on the phone or via Zoom or communicating regularly with those who may be providing some of the day-to-day care. So let me advance. And what you see on your screen here really is a general list of observations and details to keep in mind. The more detail you can generally provide to the medical team, the better things are all around. In particular, now with a lot of appointments being telemedicine, providing this high level of detail can make a huge difference in the quality of care that your loved one receives. So make note of things day to day when you observe, and your doctor can give you a more specific list of symptoms to monitor. I know with my mom who has Parkinson's, I keep sort of a notes section on my iPhone where I note some of these changes, something like the number of steps she can climb or the distance she can walk without sort of giving out, or the amount of time between tremors, if her medications have been adjusted. So those are all examples of details that you may want to note and report back to your loved one's medical provider. The other important thing that we'll underscore here is don't jump to a diagnosis. And I know this is incredibly hard not to do, particularly in the world of WebMD and Google and all of that. It's so easy for us to jump to conclusions, but it's critical not to accidentally lead your loved one's medical team down the wrong path. So the example you see on your screen, saying something like, my mom has shortness of breath when walking short distances versus, my mom has bronchitis. Your mom may have had bronchitis multiple times, and that's a simple assumption to jump to, but it's important not to lead their medical team or those providing care down the wrong path. Another example that we here is, uncontrollable crying or even laughing. Oftentimes we want to self-diagnose, oh, they're depressed, and, communicate it that way to the doctor. But, those type of behaviors can also be a sign of stroke, or it can be a sign of TBI, traumatic brain injury. So it's important to not make that quick jump, if you will. So before we do a bit of a wrap up, I know that Nicole has another poll question for us. So while she reviews that, I will go and activate
Great.
that.
All right, so this is our last poll question that we have for you today, and it is, what areas could you use the most support with given your caregiving scenario? So your options are in-home care. This can mean additional in-home support for nursing care or help with housekeeping like tasks, things like that. Financial support, so things like programs that can help defer costs of certain medications. Emotional support, finding a support group that you can attend in person or connect with virtually. Care management, if you're your loved one's primary caregiver, you may need additional supports in working with the other members of your loved one's care team. You're kind of, rallying the troops, so to speak. So there can be some additional supports that you need for that. And your last option is other, and this would include anything that doesn't fall into those categories. If you select this one, please feel free to share more details in the chat.
Fantastic. Thanks, Nicole. So I will leave that poll up so everyone can make sure that they weigh in and cast their vote. But we're just want to do a quick little review today. We started talking this morning about what all those tools that can help you manage your loved one's care includes. That's the medication list, that's the patient file. Having all of that information handy and well organized really is key. Again, that can be found if you click on the Offers tab on the right-hand side of your screen. It's available and accessible 24 hours a day. We then touched on the importance of having what we would consider a successful ER visit. I know these are often unexpected. So, making sure you are, getting everything that is needed in those instances is really important. We talked about staying calm, how to talk to the doctor, and then really explored, reporting those symptoms, how you should do it, what you should take into consideration. And so at this point, we want to, take into account any questions that you may have at this moment. I know we've received some questions via direct message and some other questions in advance. So Nicole, I'll come back on screen while we are answering these. What have you gotten on your end?
So we have had some questions come in. And so the first one is, how do I communicate updates to the other folks who help take care of my mom?
That's a good question. And that's something that my family and I deal with. There's a lot of extended family that like to stay in the loop. So, I think me and my immediate family have sort of a family text thread that we, are able to send updates back and forth to each other on. And then in regards to sort of communicating to extended family and others that are helping provide care, what I've found helpful is to really develop, a message that can be copied and pasted and sent to a lot of different people. My uncle in particular, he has heart failure and is in and out of the hospital a lot. So I see my cousin, his daughter, develop sort of these text explanations of what's happening, and then she'll copy and paste it and be able to send it to all of the family. Same applies for email. Really figuring out how folks best can communicate with each other. Obviously, the communication component can be an overwhelming piece to all of this. So figuring out how you can streamline some of that so you aren't having, the same conversation dozens of times really can sort of reduce that stress for you as the caregiver. Nicole, I don't know if you have any other thoughts. That's just sort of how we've addressed it with me and my family.
No, I think those are really great suggestions. The only thing I would add is, especially if you are a long distance caregiver, make use of the time that you may be in person with your family and with other members of those care teams. So whether it's a holiday and you guys are all getting together, things like that, use that as an opportunity to have those family meetings to kind of discuss plans and updates. because, there is, I think, something to be said for utilizing that in-person time, because it can really be helpful. But I think, a lot of what Chance covered also applies there, just making sure that you're using that kind of regular language so everyone is on the same page.
Absolutely. It looked like we got a question that I'm going to throw to you. A question here. My parents live in the U.S. and I need to find local in-home support for them. They're having more and more difficulties with day-to-day chores. Where do I start in doing that research?
That's a great question. And especially for long-distance caregivers, there is going to be a need to, whether it's finding someone that's able to help in home, or just finding resources that are in your loved one's kind of local area, that can be a challenge. My one thing I think that is a great place to start is utilizing the Caregiver Help Desk. You can find information on the help desk at the USAID caregiverscan.org website, but we also have some information here on your screen with a phone number, but it's a phone number. There's also, I think, a capacity to email on the website as well. And so it's really great. Monday through Friday, 7 a.m. to 8 p.m. You can go in and reach out to a caregiving expert, and they can listen to your particular challenges, your scenario, and really help you find some great resources. And that means also those local resources. So if you are looking for that in-home support or something that's local to your loved one, they're going to be able to help you kind of sift through some of that and find the best connection there.
Yeah, absolutely. I couldn't agree more. We are constantly hearing about how successful the help desk team is able in connecting folks with local resources, both in cities and in rural areas. Their reach and understanding is really, really thorough. So couldn't agree more. It looks like we got one other question thanking us for the helpful info. Fantastic. Glad to hear that it's helpful. They're asking, how can I get further updates on more tools and information like what you mentioned today?
Well, if you go to the USAID caregiverscan.org website, there is the ability to sign up for Take Care. And Take Care is our newsletter that comes out monthly. And we provide updates to not only our existing resources and tools in the newsletter as those kind of roll out, but we're always introducing new resources, tools, and things. And that's really a great place to kind of stay in the know. So I highly recommend checking that out.
Fantastic. Well, as we wrap things up today, I just want to encourage everyone to stay connected with us, be that Facebook or Twitter or via the help desk. So I want to take time to thank everyone who joined us today. This webinar will be available on demand on the website. We'll also be emailing folks a link with all of these resources as well following today's presentation. So thank you again for joining us. It's been great to spend some time with you today. I'll leave you with that also helpful Caregiver Help Desk number on your screen. And then thank you and have a great rest of your day.
Thank you, everyone.